Good evening, I'm Adrienne Arsenault. Tonight, a surge in COVID-19 cases and one looming problem.
My biggest concern right now is medical supplies.
Quebec has less than a week's worth of supplies left, and frontline workers are pleading for help.
I'm Andrew Chang. Also tonight, the virus devastates seniors' homes.
It's just fairly hard to put into words.
More deaths, growing outbreaks, what you should consider if you have a relative in a long-term care facility.
It wants to take all the life out of your lungs.
Ventilators are in high demand to treat the critically ill. Why many patients who get them still don't survive.
And sick of people ignoring orders to physically distance themselves? You're not alone.
People, stop looking for loopholes. Stop ducking under the police tape.
Rick Mercer is back with an isolation rant you will not want to miss. This is The National.
We are now at a pivotal point in Canada's battle against COVID-19 as the expected peak draws closer.
And as we wait to find out just how effective all these isolation and distancing measures have been, frontline healthcare workers say they can't wait for crucial protective gear.
We know that the demand for critical equipment and supplies will grow in the coming weeks.
Today, the Prime Minister said Canadian industry will accelerate making that much-needed equipment. Welcome news and timely as health workers across the country plead for more. And amid the worry and exhaustion, a grim milestone. More than 100 people in Canada have now died, including 6 today in Quebec, which saw a big one-day jump of more than 730 cases. The situation in Quebec is now clearly one of grave concern. They've got nearly as many infections as the rest of Canada combined, and there are fears things could get worse. With the Premier warning today, medical supplies are running low. Alison Northcott takes us there.
Tuesday of last week, I got a fever.
Adrian Moss says he barely had symptoms, but having returned from a family trip that included visits to France and Spain, he got tested for COVID-19.
And lo and behold, I came up positive.
He's one of more than 4,000 people diagnosed in Quebec, and along with announcing more than 700 new cases today, Premier François Legault also addressed a looming problem.
My biggest concern right now is for the medical supplies. Currently, for some equipment, we have only for 3 to 7 days.
The province has used a year's worth of supplies in just 4 weeks. The Premier says more should arrive in the coming days.
The situation is certainly evolving as we see our cases surge.
But some on the front lines are worried and are trying to ration the supplies they have.
Our objective, besides treating the patients as best we can, is to protect ourselves so we can keep treating patients and not end up in quarantine ourselves or sick.
Legault says the Quebec situation is due in part to a badly timed spring break in early March. Thousands of Quebecers took trips abroad before travel restrictions and orders to isolate. Experts say testing could be part of it too.
Per capita, Quebec tests more than everybody else. But we still would like to perform more because I'm thinking specifically in the regions where they don't have a lot of cases, then it would be the right time to test more broadly so that they can really identify early cases that are very few symptoms.
Montreal is ramping up its response, setting up tents to act as day centers for the homeless and opening new shelters that allow for physical distancing.
The health crisis that we are going through cannot become a social crisis.
While Quebec's premier acknowledged the growing number of cases, he reminded Quebecers that the situation here is not as desperate as those in more heavily affected countries. Alison Northcott, CBC News, Montreal.
So you just heard Quebec's supply of masks could run out within days. As shortages loom across Canada, the federal government said today it is working with industry to quickly produce what's needed. More on that in a moment, but first, here's Briar Stewart on the healthcare workers who need protection on the front lines.
This is as far as Dr. Joseph Finkler ventures these days. The ER doctor is in isolation after testing positive for COVID-19 last week.
I guess I felt a tiny bit invincible until I got this.
At first, he thought his fatigue came from working night shifts. He also thought he knew why his sense of smell disappeared, another coronavirus symptom.
You go into an emergency department, it's not like a perfume parlor. It's quite the opposite. It's more like a garbage dump. But we were wearing face masks. I thought, oh, that doesn't smell so bad in here as usual.
But when Finkler got night sweats and the shakes, he went to this testing site. 24 hours later, a positive diagnosis. He doesn't know how he contracted the virus. He was wearing protective gear, and so far, none of his colleagues at St. Paul's Hospital in Vancouver are showing any symptoms.
You won't find nobody without full gear. People are quite paranoid.
Because they know how fast the virus spreads and how deadly it can be. More than 60 doctors in Italy have already died.
For sure, protecting the health workforce is absolutely critical.
Federal public health officials say there is no national tally of infected doctors and nurses. That data comes from the provinces and territories. Today, Alberta confirmed 77 healthcare workers there are infected, and in the Windsor area, around 15. Most are Canadians working in Michigan. The Canadian Medical Association says it's hearing from doctors worried about the lack of personal protective equipment in some facilities.
We have to protect them before they go into this battle. And it is a battle, and their health and their lives are at risk.
As for Dr. Finkler, he believes his hospital has enough safety gear for now, but many more patients are expected to come through these doors. Briar Stewart, CBC News, Vancouver.
Protective equipment can't come soon enough. So the federal government is signing contracts and spending $2 billion to meet the need as quickly as possible. But how quick is that? David Cochran looks into it.
The government of Canada has agreed to purchase some of our DNA testing devices and also our test kits.
Paul Lem is one of the Canadian business leaders answering the call. His company, Spartan Bioscience, makes newly approved portable test kits that can deliver results in about 30 minutes. Once scaled up and shipped out, they could expand COVID-19 testing capacity dramatically.
We're targeting within a few weeks we're going to start shipping. And so we've already been spending millions and millions of dollars ramping up our supply chain.
While people like Lem get building, ministers like Anita Anand have been buying, scouring a frantic global market for every available supply.
We have now managed to secure more than 157 million surgical masks to support the response. To date, we have also ordered more than 60 million N95 masks.
Some of it is already here, some on the way, while thousands of companies have offered to retool or ramp up to make everything from gowns to gloves to sanitizer. Canada has also bought or ordered 1,500 ventilators and is working on 4,000 more, some built in Toronto by Thornhill Medical.
We're able to start to help Canadians as early as next week when we produce our first ventilator systems that are going to go off the line to Ontario. And then we're going to expand our capability.
All of this will take weeks to be fully up and running, a short time in the life of a company, a long time in the middle of a pandemic. So the Canadian government will keep hitting global markets trying to buy two crucial things: supplies and time. David Cochran, CBC News, Ottawa.
So the number of known COVID-19 cases in Canada has jumped by more than 1,000 again today to just over 8,600. As we mentioned, Quebec saw the biggest surge, followed by Ontario, then Alberta. British Columbia reported fewer cases today than yesterday, its lowest number in a week. But the cases worrying the federal government the most are those showing up in some particularly vulnerable groups.
We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility. These events are deeply troubling.
And in some places, they're now deadly, too. A nursing home in Bobcaygeon, Ontario, has now lost 12 residents and a volunteer to the virus. And as Ellen Morrow tells us, the fear is that number could grow.
A lone hearse at a place where death is now heartbreakingly common.
It's not fair. It's not fair.
Mary Lou Ferguson's friend Mike St. Thomas died at Pinecrest Nursing Home on Saturday. The two met nearly a decade ago when St. Thomas joined the local Legion.
Just full of life and full of love. He was just a terrific, terrific guy.
13 deaths have been linked to the outbreak here. Dozens more, residents and staff alike, are sick, and the close quarters aren't helping.
Many of the rooms at Pinecrest are shared, and that's made it easier for the virus to spread in the facility.
Even hope here seems dark.
I really hope not all the residents die.
Dr. Michelle Snar, Pinecrest's medical director, says options to move residents, whether they have the virus or not, are limited. She says the local hospital is at capacity, and decisions for the sick now center on comfort.
If they're going to die, it would be more comfortable to die in your home.
That means Pinecrest, where with so many staff sick themselves, family members say more support is needed. A plea Snar has made to several organizations.
We're all going to have PTSD after this. It's a war, and so we just have to keep soldiering on.
Mary Lou Ferguson is soldiering on too, in grief.
It makes you cry. And because you can't go out and hug somebody. I gotta stop.
Hugs for now, and so many lives stolen by COVID-19. Ellen Morrow, CBC News, Bobcaygeon, Ontario.
And scenes like that strike fear in people whose loved ones live in seniors' homes. So what can you do to help protect them? Thomas Dagla has some options.
Cleaning and disinfecting is just one step, with seniors' homes increasingly battling COVID-19 outbreaks. More than 50 facilities across Canada have seen infections, including this complex in Nova Scotia, where a staff member tested positive.
They went into no visitors mode.
John McCall's parents live at the long-term care facility. Visitors are now barred, and he's left with no way to help.
Them both being in their 90s and my mom having some breathing issues, some chronic asthma. It's very concerning, and there's absolutely zero we can do about it from here.
This Quebec seniors complex has been on lockdown for 10 days, with residents confined to their apartments. Still, the virus has claimed 6 lives. All that leaves families wondering, should they bring their relatives home, even temporarily?
If you do have capacity to take home your loved one from long-term care, I would encourage it. I would certainly do it if I had a loved one in long-term care.
But the management at this long-term care facility has a warning.
To suddenly bring someone home and frankly toilet them and transfer them up to 20 times a day and dispense their meds, etc., it's a lot of work.
That Toronto facility has closed its dining room to slow the spread, but still, 3 residents have tested positive and 1 has died. Across the country, families may consider asking about what protective equipment is kept on site and what sick leave policies apply for staff.
I'd want to know, what is your plan for rapidly identifying and managing ill patients, and how are you screening people when they come in? Do you have enough equipment and supplies?
They're small steps in a pandemic where families feel increasingly helpless. Thomas Dagg, CBC News, Toronto.
Now, even though COVID-19 seems to be most dangerous for older people, there are more cases of younger and middle-aged people getting sick. In all, Alberta has more than 750 cases, but look at the age breakdown. More than 40% of people hospitalized are between 35 and 54. And as Rafi Boudjikanian reports, a community in northern Alberta is now mourning the death of the youngest victim in that province to date.
Better hurry. It's in a good game. It's 4-3. Some 9 minutes left in the third.
34-year-old husband and father of 3, Sean Auger, was all about charity and hockey.
He was somebody that you would model one of your staff members after.
Social worker Shane Farnham would know. They were friends and co-workers.
He taught me so much about, self-confidence and backbone.
Auger dedicated his life to helping young people in High Prairie in northern Alberta. In his spare time, he coached youth hockey. It was hockey that brought Auger to Edmonton in early March. He saw an Oilers game, staying overnight in the city. About a week later, he was diagnosed with COVID-19 and hospitalized. It's not clear where he was infected, though his sister said Edmonton was his only recent travel. Auger's asthma complicated things, until this weekend, telling loved ones he expected to recover.
We were joking around about how once he got better, he was going to be the first, he was going to be a legend.
Farnham dreaded the worst when he missed a call from a mutual friend.
I knew what it was. I called him back, and he was a wreck, and that phone call is going to haunt me for a long time. And
friends are remembering Auger for his love of playing pranks.
Jody, don't be shy. Take a big bite.
But I was always careful when Sean was around.
The local hockey league will have big skates to fill.
If he was at the arena and a team's coach couldn't make it, and if his stuff were there, he'd put his stuff on and go on the ice.
Farnham sees a dark truth in his friend's passing.
you think it's a joke and it'll never happen to somebody that you know, and you hear about it on the media, but it doesn't become very real until somebody that you love and care about is affected by it.
All too real for a community now saying goodbye. Rafi Bujikanian, CBC News, Edmonton.
Now, if you're wondering how long our daily lives will be constrained by this pandemic, today, BC warned restrictions could last into June. And the City of Toronto is canceling all major city events and event permits until the end of June.
Many of these events, of course, involve thousands of people, sometimes hundreds of thousands of people, and it is doubtful that the health environment will be where it needs to be on the originally scheduled spring dates if these events are to happen in a healthy, safe, and stress-free way.
So that means the Toronto Marathon and Pride Parade are canceled, though the mayor said the city will still find a way to mark Pride Month. He also announced all city facilities will be closed until further notice. Good time to bring in Dr. Allison McGeer, an infectious disease specialist with Toronto's Mount Sinai Hospital. Dr. McGeer, right through June, I mean, that's 3 months. You expect we'll still be walled off from each other even then?
Well, I think there are two things about this that are hard. The first is the uncertainty, and the second is thinking it's going to go on for a long time. And so I think it makes a lot of sense for people to say now, okay, we're not going to be out of this in the really short term. We're still going to be worried about it and doing something about it at least until June. Better to say, okay, let's cancel things now. You can always uncancel them, right? If things get better, we're going to walk this back. Going to allow more things. So I think it's actually kind of helpful at the moment to say, all right, now we've really got to start hunkering down. We know this is going to go on for a while. We've got to manage it for a while, and better to maybe go a little further than we might be hoping for, than keep saying another 2 weeks and another 2 weeks and another 2 weeks.
Right, and everyone's got to pull their weight in the meantime, of course. Dr. McGeer, we're going to talk more a bit later in the program. Thanks very much.
This pandemic is developing differently depending on where you live. So Anita Bath is tracking stories from communities across Canada for us tonight.
Adrian, beginning this hour with the Atlantic provinces, 20 new cases of COVID-19 in Nova Scotia, bringing the total to 147. And a warning about a scam as people try to take advantage.
If you are being approached with information, if somebody says, I have this wonderful product that is going to boost your immune system 200% and make sure you don't get sick with COVID-19, or I have this product that will cure you from COVID-19, those are that is false.
3 new cases in PEI, all related to travel. But the province has also been getting a lot of questions about grocery shopping. And of course, this information is relevant to people across the country. Residents being told only one member of each household should be the designated shopper, and that should only happen when necessary.
Try to choose items that are wrapped and that can be easily wiped clean with a disinfectant wipe. And when it comes to fruit and vegetables, washing them with soap and water when you get home. Avoid touching your face while shopping and on your route home. And wash your hands or use a hand sanitizer as soon as you get home.
New Brunswick and Newfoundland and Labrador both seeing a lower number of new cases today, but both provinces are warning people shouldn't be overly optimistic because things can change in an instant. Both are still expecting their numbers to climb. Adrian?
Thanks, Anita. Well, rents are due tomorrow, and many business owners are scrambling to come up with the money. With stores closed and little revenue coming in, many say it really is only a matter of time before they won't be able to pay at all. Tina Lovegreen has some of their stories.
Inside this Vancouver store, inspirational quotes are everywhere you look. Hope is harder to come by.
I'm used to being successful, and I'm used to having my stores open. These are some of my favorite things.
Both locations have been closed for 2 weeks. All the staff laid off. With no revenue, she's dipping into savings to pay $12,000 in rent.
I have a plan for 3 months on both locations. Outside of that, there's no way I can go forward.
Coffee chain JJ Bean has been able to keep some stores open, but with limited hours and restrictions, they've lost 80% of their revenue, making the nearly $270,000 due for all 26 locations almost impossible.
Got a number that have agreed to defer 3 months of payments, April, May, June, and then have me pay that all back next year.
The Canadian Federation of Independent Business surveyed 10,000 owners.
About a quarter of them are saying that they can't make their rent payment. That's higher for some sectors. So, for example, hospitality, we've got 40% saying they can't make their rent.
They're calling for a reduction in property taxes and for landlords and tenants to compromise.
I don't think people realize how huge this is going to be.
This lawyer says some landlords are deferring rent or accepting partial payments.
I think it's just a matter of taking a deep breath, making an arrangement now, and checking in again in a month's time to see where we're at.
Ottawa is offering to foot 75% of employee salaries, but for stores that have inventory gathering dust, it's not enough.
What really needs to happen is a true bailout.
Without that, it can be difficult to see light at the end of the tunnel. Tina Lovegreen, CBC News, Vancouver.
Well, sobering message tonight from the White House.
We're going to go through a very tough 2 weeks.
Up next, the U.S. reveals how it thinks the pandemic will spread while New York is already living the grim reality.
Millions of students learn school is out for a little longer, but the lesson plan, well, that depends on where you live.
And he's back with a rant from isolation.
Why not just French kiss each other, go home and catch your house on fire? And the neighbor's house, too.
We're back in 2. The number of people who have died of COVID-19 in the United States has now surpassed China. And as Susan Ormiston tells us, the president is warning the next few weeks will be especially difficult.
This is the scene outside my job right now.
Ambulances stacked up, waiting to get into an emergency at a New York hospital. A nurse recorded the jam as the city's emergency services struggled to cope.
I've never seen 7,000 calls in EMS. To give you some perspective, that's more than 9/11. So basically, we've had 9/11 type calls for about 8 days now.
More deaths than yesterday. A 49-year-old mother in Brooklyn died Sunday night, but her family can't even get a medical examiner to respond.
There's a dead body right now upstairs, almost 24 hours. What are we supposed to do?
As more of America's cities empty, residents ordered inside, field hospitals in many states going up fast. The number one question, how long?
This is going to be a rough 2-week period.
This map shows where the virus has spread in America, widely, swiftly. Just look at the difference with Canada. The president's team repeated a grim projection. 100 to 240,000 may die.
We should be prepared for it. Is it going to be that much? I hope not. And I think the more we push on the mitigation, the less likelihood it would be that number.
So, 30-plus more days of physical distancing imperative. President Trump now embracing the gravity.
A lot of people have said, a lot of people have thought about it. Write it out. Don't do anything. Just write it out and think of it as the flu.
1 week ago, he did too.
36,000 deaths a year. People die, 36 from the flu. But we've never closed down the country for the flu.
Now it mostly is closed down. And that projection of over 100,000 deaths could be brought down, says the task force, if Americans stay home, if they embrace deserted streets like this in the U.S. Capitol for at least another month. Susan Ormiston, CBC News, Washington.
To a couple of other global hotspots now, beginning in Spain, where today the country reached another sad marker. Overnight, the country registered 849 deaths from the coronavirus. That is the highest number in 24 hours since the epidemic started. And in Italy, mayors across the country ordered flags lowered to half-mast and observed moments of silence to honor the coronavirus victims. More than 11,500 people have died there since the outbreak began. And for weeks, the Russian government insisted coronavirus was not having a serious impact there. Now, as Chris Brown tells us, Moscow is almost entirely locked down, and anyone who spreads the disease to people who then die could go to jail.
As far as photo ops go, this seemed like a good one for Vladimir Putin. He put on a bright yellow hazmat suit and gas mask and toured Moscow's main infectious disease hospital with top coronavirus doctor Denis Protsenko. But not before he shook Protsenko's hand, rode in a small elevator together, and spent a lot of time not practicing social distancing. Today, Protsenko acknowledged he tested positive, sending Russian state TV into a frenzy. It's around everyone now. It's even around the president. All of those who are supposed to save us from corona, exclaimed the host. It's unclear if Putin is now in isolation. He's only been seen since alone in a teleconferencing room where he ordered Russians to quit ignoring directives to stay home. Just 2 days ago, Moscow parks were full of people having large group picnics and barbecues, which prompted the city's mayor to order a near lockdown of the capital. We're scared, this woman told our crew. I hope to God people listen and stay inside. Independent Russian journalist Denis Strelkov says the capital can likely cope with a deluge of cases, but other regions won't be so lucky.
If we imagine that we are going to have a this virus all over Russia, in every region, it's going to be not just bad, it's going to be way worse than the United States. There is no really, there is no effective system of medical care.
But even with the coronavirus stalking the highest levels of the Kremlin, Putin's administration still managed to seize an opportunity for a propaganda win. Russia has already sent plane loads of humanitarian aid to China and Italy, and today Putin offered help to Donald Trump, which he apparently accepted. Chris Brown, CBC News, Vancouver.
We keep hearing about how ventilators are in such high demand as hospitals brace for the worst. So up next, a closer look at that critical piece of equipment and the challenges and risks that come with it.
And in just a few moments, as we do every night, a team of doctors poised to take your questions, including this one. What's the straight goods on masks? Are we just being told not to wear them out of fear we'll start hoarding them? Stick around.
Welcome back. We know that the vast majority of people with COVID-19 don't need to be hospitalized, but for those who are critically ill, a ventilator is a key weapon in the treatment arsenal. So just how effective are they? Christine Birak takes a look.
In severe cases, those with COVID-19 say they feel like they're drowning. You can hear this patient struggling to breathe.
It wants to take all the life out of your lungs.
Ventilators offer oxygen. That's why they're in high demand. But critical care doctors say many patients placed on these machines don't survive.
The outcome for a patient who has to be ventilated if they have COVID-19 is horrific.
Chinese researchers studying critically ill patients on ventilators in Wuhan found in a group of 32, only one person survived. Another study from Wuhan suggests about 20% of patients on ventilators recover.
There are risks both to the patient and to the healthcare workers that are involved.
If we could get some intubation medications.
Doctors and nurses can be sprayed with virus while placing a patient on a ventilator. A delicate part of their job is to carefully guide a scope down the patient's throat, then lift a small flap of tissue to make way for a breathing tube. Once connected, the ventilator often blows in 100% oxygen. The average room air is 21%. After several days on a ventilator, high levels of oxygen can become toxic, damage the lungs, and lead to other serious complications.
You got to be pretty sick in order to need a ventilator. It's going to take a while for their lungs to get better if they do get better.
Early North American estimates show about 6 out of 10 patients on ventilators are surviving. They're often younger and do not have underlying health conditions.
So that raises the big question. Do you cherry pick people who you think are most likely to survive?
Right now, most provinces are developing rules in case doctors are forced into that situation. Christine Birak, CBC News, Toronto.
Now, as we do every night, we have two doctors standing by to take your questions, Dr. Alison McGeer and Dr. Lisa Barrett, both infectious disease specialists. But both of you were also watching that piece from Christine Birak about ventilators, and I'm curious to get your thoughts, because that question from Dr. Gardam at the end, Dr. McGeer, how do you decide? How do you make that choice about who gets a ventilator?
So to me at the moment, the most important message about that question is this is what we are trying to avoid. The fact that we're seriously having a discussion about this in healthcare is why people are begging you to just stay home. Social distancing, physical distancing now is critically important, and the reason it's critically important is so that we don't have to make those decisions.
Okay, let's get to some of our questions. Dr. McGeer, this first one goes to you. What happens when our frontline doctors and nurses get sick? Who replaces them?
All hospitals have pandemic plans for how they're going to respond to an increased number of patients and how they can be managed. Part of that, as we've seen, is about canceling elective surgery, trying to make sure that we minimize the number of other patients in the hospitals so that we can provide health care. Part of it is about retraining of some of us so that we can get back into healthcare. You know, what AI can do for us, what technology can do for us that makes us work more efficiently. So in truth, there's a whole long list of things, and all hospitals are working on them so that we make sure that we can both replace healthcare providers should they be off sick for a while, but also so that we can respond to being able to being needed to take care of more patients.
Okay, good insight there. Dr. Barrett, this next one's a tough one, a contentious one, I should say. What's the straight goods on masks? Are we just being told not to wear them out of fear we'll start hoarding them?
The straight goods are not that we're trying to keep all of our protective equipment for just healthcare workers, but this is also a question of what a mask does. And there's two things. There's particles getting out from the person wearing the mask, and there's virus potentially getting in. And the reason we haven't yet told everyone in Canada to wear a mask all the time is that, number one, we haven't had as many cases, and the amount of risk to experience virus in the community has been lower until recently in most places. And the second part is that masks can actually be harmful and provide a false sense of security. You need to know how to take them off properly, and we need to know that the kind you're using works, and we don't know both of those things right now. If you use a mask improperly, it can be dangerous, and if there's not a lot of virus around you in the community, this community shedding idea, if there's not enough virus around, the risk is not worth the benefit.
Okay, very good information there. Dr. McGeer, we have time for one more quick one. What would signal that things are starting to get better?
The first thing we're looking for, things starting to get better, is that the number of new cases every day is going down. Now, at the moment, that's really hard to judge because our testing is ramping up. And of course, if you test more people, then you're going to find more cases. We're having some trouble keeping up with testing. So maybe things will look better for a day just because one of the labs had trouble with reagents and is a little bit behind. And then it'll look bigger the next day. So it's actually, you can't actually look every day and know for sure what's going on. But overall, we're aiming for firstly, the number of new cases every day either staying the same or going down as opposed to going up.
Okay, we're going to have to cap it off there. Dr. McGeer, Dr. Barrett, thanks so much for your time. Really appreciate it.
Thank you.
Now, tomorrow night, this segment is going to take on a special focus: your finances. So whether you're a business owner or an employee, or whether you pay a mortgage or rent, a lot of uncertainty right now. So tomorrow we're going to turn to financial experts. Send your questions to @CBC The National, that's on Instagram, or you can email your questions to thenational@cbc.ca.
And ahead on The National, a message from an old friend, a rant from isolation.
Do you know what you don't do during a pandemic? Visit an art gallery. And I know
Rick Mercer on Canadians during a pandemic. He's got something to say tonight.
But first, as we go to break, a taste of what you'll find here on the program going forward, a regular how-to on navigating COVID-19. If you get sick, it'll most likely have been because the virus found its way onto your hands, and then you brought those dirty hands to your face. So what's the best way to keep your hands clean? Well, first thing, there's actually an internationally recognized World Health Organization endorsed gold standard of hand washing, and it's set to a familiar tune. So let me just wet my hands first. I'll get a little bit of soap on. Brace yourself, I'm gonna actually sing for you. Scrub the palms between the fingers. Wash the back. Wash the back. Twirl the tips around. Scrub them upside down. And this is to get the fingertips. Thumb attack. Thumb attack. As to whether you use hot or cold water, doesn't really matter. It's the soap that is washing those germs down the drain.
Welcome back. In every part of this country, the pandemic has simply destroyed the normal school year. Today, 2 provinces made big announcements. So where does that leave students and parents? Deanna Sumanak-Johnson shows us it may depend where you live.
Hey guys, what are you doing?
I'm playing Prodigy.
For these kids and 2 million others in Ontario's publicly funded schools, a day of big news.
Publicly funded schools will remain closed until May 4th. We're taking the next steps to provide continued learning for our children by unveiling a new teacher-led program.
When you finish the multiplication,
Some of it long overdue, if you ask some Ontario parents.
What I found most frustrating is when this first started, the government sent out their phase 1 plan, and it was really a non-plan. They sent out a bunch of links, and they effectively turned us all into teachers.
But in another province, a different reaction. Alberta waited longer to close its schools, but once it did, parents received a distance learning plan this mother of 2 calls realistic.
All they decided to do was have at least 5 hours of work for the kids to do over the course of the week. So about an hour a day. It's not really marked or graded, but the teachers are helping and they're sending home corrections.
Alberta schools are closed indefinitely. 4 other provinces and 1 territory have announced the same plan, including Manitoba earlier today.
Manitoba's K-12 schools will have their in-school classes suspended indefinitely for this school year.
When you are learning new concepts, and you will.
Up until now, teachers in that province were told to keep students engaged in learning activities like watching documentaries. For some, saying hi was important for other reasons.
It's this time to really check in with our kids and not ask, hey, how's your homework going? But just ask, hey, how are you doing? Are you functioning? Are you talking to people?
Maintaining a sense of normalcy for students is a goal shared by educators across Canada. Most provinces also made a commitment that students will move on to the next grade or graduate, no matter when schools reopen. Deanna Sumanak-Johnson, CBC News, Toronto.
Next, David Common gives us a lesson in physical distancing. First, though, a look at how 2 Cape Breton brothers are using their canceled classes to forge a brand new career. They have launched a weekly online newscast, East Coast Kids News.
Hi there, my name is Liam Sakalaskis and welcome to ECK News. Tonight I will be giving you some tips of the COVID-19.
Liam and his brother Lucas got the idea from their dad, Herbie. He's the video production specialist at Cape Breton University. So the boys help with every aspect of the show, from setting up the green screen to choosing the stories. Lucas, by the way, is the meteorologist.
Sunday, sunny, high +4.
There are reviews of kid-friendly apps, a salute to special days, even a science segment.
Did you know polar bear's skin is actually black? See you next time on ECK News.
Well, Canadians may get a little tired of being constantly told to observe social restrictions like physical distancing, because overwhelmingly, most of you are doing your part to flatten the COVID-19 curve. But even if those reminders seem a little naggy, don't expect them to go away, because as David Common tells us, they work.
For the most part, we've got this physical distancing thing down. Customers keeping 2 meters apart, gathering places shut down. Even the ducks seem to have it sorted. And there's plenty of tunes to emphasize distancing.
If you don't want this virus, well then stay 6 feet away. Super damn important that we practice isolation.
Playgrounds, now closed, remind us to stay 1 hockey stick apart, so Canadian. But what about passing on the sidewalk? Many of us doing the distancing deke out.
When's it okay to say to somebody who's a bit too close, back off, buddy?
Time to call epidemiologist Dr. Isaac Bogach.
We do the best we can, and of course there's going to be situations where, if 2 people are crossing on a narrow bike path or on a narrow walking trail, there'll be a second or 2 where they're going to be in closer contact than the 2-meter rule. Is anything going to happen in that fraction of a second between 2 people passing? No, it's not. I think we could all be a little more calm about those, tiny situations that may occur.
Those may be unavoidable, but sometimes others are just being stupid. Author and journalist Robin Doolittle had a masked man push her out of the way just trying to leave a store.
So what do you do with those people who just don't seem to quite get it? Perhaps a social distancing stick is what we need. Get back.
It's not acceptable. I mean, we really have to be careful about this 2-meter radius. We really have to spread apart. Mask or no mask, I think that's completely irrelevant. I remember the episode of Seinfeld. There was the close talker.
Hello, Aaron.
Hello, Aaron. So how long are you folks in town?
And, this is what we've got to avoid.
How about you, Jerry? I'm sorry.
Yeah, this was never good, especially now. And Canada's top doctors keep emphasizing it.
Whatever your situation is, stay in your bubble. And please, don't step outside of it and don't burst anyone else's bubble.
So keep that 6 feet or 2 meters apart. You just don't know who's infected or who might be vulnerable. David Common, CBC News, Toronto.
Okay, next on The National, Rick Mercer has a few words from isolation.
Congratulations, you found yourself a loophole. People, stop looking for loopholes.
Some much needed humor with a serious message next in our moment.
someone did the math. Turns out I have walked 42 kilometers in this alley since we began.
You know that face. That's Rick Mercer with one of his classic rants from Graffiti Alley. But like so many of us right now, he's staying home. But he still has some things to say to Canadians. He always does. His rant is our moment.
Why am I not in my alley? Because there will be people there. And what will they be doing? They'll be doing what they're always doing, wandering around, enjoying the magnificent graffiti as if they were in an art gallery. Do you know what you don't do during a pandemic? Visit an art gallery. And I know technically not a gallery, it's an alley. Congratulations, you found yourself a loophole. People, stop looking for loopholes. Stop ducking under the police tape. Stop hanging out on narrow pathways. Stop jogging in groups. Yesterday, I saw a group of people walking down the street, passing around a joint. Seriously, passing around a joint? Legal, yes. Stupid, big time yes. Why not just French kiss each other, go home and catch your house on fire? 95% of Canadians, they're all doing the right things. But some of us are bending the rules, and it has to stop because it is through a loophole that the virus will get in. We can do this, but only together. All of us together. Flatten the curve, plug the holes.
You know what? That phrasing, "stop looking for loopholes," is perfect because I think if we're all honest with ourselves, we're all doing in our heads saying, "Okay, if I do X, can I then do Y?" And the answer is almost always no, you can't.
Right. Yeah.
But it's human nature to want to try.
Yeah, and every day we get questions from our viewers asking sort of variations on a theme. How much can I push the envelope of social distancing? And you're right. All we can do is really just kind of hold on and trust the advice of health experts.
Yep.
That's the National for this March 31st.
We will.
Have a good night.
Good night.